Good morning, everybody. These days, again in the news, all over, maybe the world, is about black fungus. What is it? It is one of the fungal infections called mucormycosis of the family of Rhizopus. The spores of this fungus are all over in the environment, mainly in the soil, wet walls, places of animal waste, and contaminated medical equipment. It enters the human body either by inhalation by way of nose, ingestion by way of mouth, or inoculation. Any open wounds, especially in burns and post trauma patients, it can enter into the body. A point to note here is it does not infect everyone or anyone. The specific groups of people who are infected by this fungal infection are immunocompromised patients, like cancer patients, patients on chemotherapy, especially neutropenic patients, long-term and uncontrolled diabetes, patients on long-term steroids, and post-transplant patients, especially on immunotherapy. These are the specific groups of people it normally infects. But nowadays we are seeing another group, post-COVID recovered patients. This is mainly because there is a widespread use of steroids in the management of COVID illness, as well as the immunosuppression per se caused by the COVID infection itself. So, what are the symptoms? It depends upon the organ or place in the body which it infects. It mainly infects the nasal sinuses and the orbital sinuses, rectal space, wherein they can have nasal stuffness, pain on one side of the face, from jaw to the ear, including sometimes headache. There may be a blackish mucopurulent discharge. It is a rapidly spreading disease. If it spreads to other parts like the eye, it can cause severe pain behind the eye, sometimes leading to blindness. There may be a blackish kind of a discharging pus from the eyes. If it extends to the brain, it can give headaches, altered sensorium, or fits or seizures. If it infects the GI tract, it can give nausea, vomiting, abdominal pain, or diarrhea. If it infects lungs, it can give cough, fever, chest pain, sometimes coughing up blood if the infection is severe. How to diagnose it? Those swabs are taken from the suspected areas like the nostrils, or if there is an open wound, and if it is sent for culture. Also clinically, there can be a blackish mucus or mucopurulent discharge either from nostrils or the eyes. That also is almost diagnosed. The infection is very severe. The mortality depends upon the sites of infection. If it infects the sinuses, the mortality if not treated is 46%, and if it infects the lungs, the mortality or death rate is 76%, and if it infects all over the body, it is called a disseminated infection, where by way of blood vessels it enters to different parts of the body. In such cases, the mortality is very high, almost according to 96%. So, how to avoid this? Like I said, prevention is better than cure. Especially patients in the above groups I mentioned, immunocompromised patients must keep a very good hygiene number one. Number two, always use the mask. And number three, at the first sign or symptom of the aforementioned symptoms, approach your family doctor or the specialist. And the treatment for this one is a must, and it must be prompt and appropriate. Mainly two modes. One is surgical, removal of the infected tissues, and even if the bones are infected, they must be removed, along with adjuvant therapy by medicines. The mainstay medicine is lipophilic amphotericin injection B, amphotericin B, or posaconazole or isavuconazole. These are the treatment modes. But important points to remember here is it does not infect each and every individual who has COVID. Only in those individuals, especially immunocompromised or people with uncontrolled diabetes or neutropenic patients, especially cancer patients on chemotherapy. So these patients must follow the rules of hygiene, having a mask, and prompt recognition and treatment if one is infected. So I hope and wish this information will be useful to you, and everybody will take care appropriately, and wish good health for everyone. Thank you, one and all.